Hello and good afternoon or good evening or good morning, whatever time of day it is that you're watching this video. Thank you so much for taking time to tune in, and I hope you find the information helpful. My name is Natalie Raymond with Multi-Business Solutions. Multi-Business Solutions is based out of Fergus Falls, Minnesota, and we provide HR, business support, accounting, bookkeeping to small to mid-sized businesses, primarily located in South Dakota, North Dakota, and Minnesota, although we can support businesses nationwide. So today we are here to talk to you about health and physical safety, and this is for employers in a variety of occupations. Although your specific occupation or your specific industry might require something more specific or detailed than what we're here to provide, we are going to talk just general overview of information that is important now more than ever due to the COVID-19 pandemic that we are facing. We do a lot of research on things that engage employees and what's important in order to keep an engaged workforce. And, a year ago or so, we would have probably told you that the most important things to an employee was to have a job that was meaningful. And yes, their benefits were important and their safety and health was important, but I think it was something that a lot of employees probably took for granted. But now that COVID-19 has happened and, they fear just for their personal well-being and the well-being of their families, health and physical safety just has skyrocketed in terms of importance to employees. So as a responsible employer, and in order to comply with all the requirements of the state, federal government, OSHA, the CDC, and all those things, we're just going to talk to you about 8 tips and things that you should really focus on right now. And again, we'll put some links in the video below and encourage you to go check it out to find more specifics depending on your industry. So if your job or occupation allows it, the first thing that I would say is, we found that social distancing is very important. And so again, depending on the industry, the easiest thing is to be able to allow employees to just work remotely if you can. And I understand that not all jobs and not all occupations are going to be able to allow for that. We, again, in the primarily accounting, bookkeeping industry, we work remotely. Normally, I work from South Dakota location. We have employees in other locations in Minnesota. And so for us, that's very possible. And software allows us to access, clients' computers remotely. However, if you are a restaurant worker, for example, or a daycare provider, we understand that remote work is probably not possible. There was a study done in September of 2019, and that was put out by the U.S. Bureau of Labor and Statistics. And at that time, they found that only 29% of Americans had the luxury of working from home. Now, during these unprecedented times, I would hope that some employers have been able to figure out how to do this when maybe they hadn't been before, or maybe they hadn't allowed their employees to do that before. We did put out a video on remote working, so if you have the opportunity and you have the situation where you have employees that are working remotely, we would encourage you to go check out that video as well. But again, some occupations are just not going to allow it. So the Visual Capitalist published an article on April 15th of 2020, and they provided a graphical representation of occupations with the highest COVID-19 risk. And when they evaluated that, they looked at 3 different criteria and considered those in figuring out which ones were high risk. So the first thing they looked at was contact with others. And they said, how much does the job require the worker to be in contact with others in order to perform it? So contact with others is the first thing. The second thing is physical proximity. To what extent does the job require the worker to perform tasks in close physical proximity to others? So that's criteria number 2. And criteria number 3 was exposure to disease and infection. How often does this job require exposure to hazardous conditions? And so they went through and they ranked a variety of occupations. You can check out that infographic for more information. But as you might expect, what they found was that healthcare professions definitely scored highest in terms of riskiness, such as, you think of your family practitioners, dentists, registered nurses, dental hygienists, and dental assistants. However, there are some non-healthcare fields that are also moderate risks in terms of COVID-19 exposure. Those included flight attendants, bus drivers, hairdressers, correctional officers, tellers, cashiers, wait staff, and more. So really, when you look at the occupation and those three criteria, that's the first thing that I would say you should consider as an employer is how much does this require the employees to be in contact with others? What's the physical proximity to others in the general community? And what is their risk of being exposed? So some jobs might require more close physical proximity, but really if it's not a healthcare field, maybe their risk of exposure is lower. So look at that and then kind of set up a criteria and set up some guidelines of what you're going to do on this. So the federal government, along with other state governments and personnel are discussing opening up a lot of the businesses and occupations that have been closed or the shelter in place orders that have been in place. And they're looking at trying to allow more businesses to reopen, more travel to resume. And Governor Tim Walz did issue an executive order requiring all businesses to establish a COVID-19 preparedness plan for opening up. So before they would be allowed to do that, they'd have to have that plan document in place. And we'll link to that as well. It's a really good just template to start out with as you think about different criteria and what you'll need to do. Even though you might not be a Minnesota business, though, you might be a South Dakota business or you might be a North Dakota business where you're not required to put this plan in place, I would say it's a good idea to try to do this and to have something. And again, your safety and your health of your employees should be very important on your mind and trying to make sure that you're doing everything you can to prevent them from being exposed to this awful disease. So again, there's also, if you go to the CDC website, there's a lot of things there. There's an interim guidance for business and employers to plan and respond to the COVID disease. And then there's other resources and guidance from the federal guidelines or federal government as well on opening up. So there's a lot of different resources out there. Again, we just want to try to help to put this down in a maybe easier to understand resource and put all the information for you in one place so you don't have to go and look that all up and spend a lot of time researching it because we've done it for you. So the first thing and the first of the 8 tips or guidelines that we're going to recommend to you is to actively encourage employees to stay home if they are sick. And that's a message you're going to have to continue to give to employees. And just remind them that they should notify you if they have any of the symptoms such as cough, shortness of breath, a fever, and they should tell their supervisor and they should be encouraged to stay home. They should follow CDC recommended steps once they're home, and they should not return to work until the home isolation criteria is met and consultation with also maybe talking to their healthcare professional or local or state governments. There might be some cases where the employee themselves is well, but they are caring for or have a sick family member in their household, and those employees should be encouraged to stay home as well. They should follow the CDC recommended precautions, and that's a lot of things like frequent hand washing, encouraging the sick person to rest and drink water, use Tylenol or ibuprofen as needed for fever and discomfort, limit contact with them where possible, wear gloves if you're, touching items that they've touched as you're changing out their bedding, make sure you wash that in really hot water and launder that frequently. Know that you should have a sick policy that employees are aware of. If you are a smaller employer that maybe doesn't have a sick policy, do recommend or do remember that the federal government came out with the emergency sick leave policy, which did provide employees for 2 weeks of paid sick time up to 80 hours, even for employers that didn't have a sick leave policy in place. And the federal government, for those employers to help bear the cost of that, they'll be able to get payroll tax credits for that. So again, you want to encourage your sick employees to stay home, or if they have, family members that they're caring for to stay home as well. And there is that emergency sick leave policy that has been built into the CARES Act. And so again, we'll kind of link to that and you can check that out as well. So that's tip number 1. The second tip number 2, would be as your employees are coming into work to screen them. And this might take different formats for you, and it again depends on, is everybody reporting at the same time? Do they have staggered shifts? How can you make this work? Who's going to be in charge of screening them? Is it their immediate supervisor? Is it, a receptionist that you have available? Is it a manager in the department? Or whose responsibility is it going to be? So think about that, but it is good to ask, screening questions such as, do you currently have a fever? Do you currently have a cough? Have you been exposed to anyone with COVID-19? Also, you can consider taking employees' temperatures. This is something that is now allowed, and that would be a good guideline or thing for you to consider as well. If an employee comes in and they don't have any symptoms or they don't have a fever when you check it, you might want to also consider having a plan in place if they start to feel bad throughout the day or start to develop symptoms. So they are, let's say, just coming into work as normal. They say they're fine. Halfway through the day, they start to develop some symptoms that they think might be COVID-19 related. And what is the process? Who are they going to report that to? Do you have a location where they can self-isolate? Are you going to let them go home immediately? So again, just a lot of things you need to think about and consider and get that plan in place. So the first step is to actively encourage your employees to stay home that are sick. The second step is to provide a screening process for employees that are coming into work. The third step, which we've kind of talked about a little bit already, but social distancing. And where we've talked about it again is if you can allow your employees to continue to work remotely, do that, of course. If you cannot, then social distancing might be, how do you reconfigure your office or your manufacturing assembly line to allow employees to stay the recommended 6 feet apart? So maybe you need to move some desks. Maybe you need to reconfigure your assembly line. However that looks for you, try to do that in consideration of keeping that social distance that we've been advised to do. For restaurants that are looking at reopening or other customer-facing retail industries, things like that, you're going to want to consider limiting the number of customers that can come in. And again, if you have a restaurant, for example, maybe you're not going to fully put everybody at all the tables like you normally would, but maybe you're going to only seat every other table, space it out a little bit so that people can stay distant as we've been recommended. Another thing, you might want to think about is maybe you need to can you stagger shifts? So if you have different employees that normally come in at all the same time, can they work a staggered shift so they can come in at different times? Again, not all industries that's going to work for, but things that you need to consider as you try to keep your employees' health and safety top of mind. Also, if you have common areas such as a break room, think about maybe closing those down or limiting employees that are gathering in those. So another thing to consider as we think about social distancing. So the first thing again is actively encouraging your employees that are sick to stay home. The second thing is to screen them as they come in and have a process that if they develop symptoms, they know who to report those to or what to do. The third is the social distancing. The fourth thing would be the hand washing procedures. And I think about just, basic things that our kids have learned maybe at school, that they sing the alphabet so that they're washing their hands a lot of times. I don't know if you've seen any of those videos either where the nurse uses black paint and paints over her hands to just show like how you have to go both sides in between the fingers, making sure that you're washing for at least 20 seconds with soap and water. And times that they recommend hand washing, of course, as you're coming into the building, before or after any meals, before and after any restroom use. If you're blowing your nose or coughing, things like that, you want to wash your hands before and after that as they leave at night. If hand washing stations are not as frequently available, then the other thing that they're telling us is that we can put hand sanitizer out, which is the hand sanitizer, of course, that's the high enough alcohol content to make sure that it's killing those germs, but making sure that, again, employees have access to that if soap and water and frequent hand washing in that regard is not possible. The fifth tip then to teach your employees would be proper respiratory etiquette. And those are the things about coughing and sneezing, coughing into, your elbow. That's one place that they say is good. You're not coughing into your hands. You're using a tissue when you can to blow your nose. And then when you dispose of that tissue, that it's going into a garbage receptacle that's safe, covered, can be taken out frequently. They're really telling us, as you probably heard, not to be touching our face a lot, not to be touching our eyes and touching our mouth. So those are just some things with respiratory etiquette to consider. And that's tip number 5. And tip number 6 is housekeeping, which is just, general cleaning of your space. How often are you going to do it? Which you're probably going to want to increase that and making sure you're doing it more often. Cleaning and disinfecting. Again, thinking about the most commonly used areas. One thing I read I thought was really interesting was that people were recommended putting like stickers on areas that people commonly touch. Maybe it's a red dot that's just a warning. If it's elevator buttons, doorknobs, light switches, all of those things to just remind people that if you've touched that area, you need to make sure and wash your hands again. Another thing they're recommending is that businesses are trying to eliminate doorknobs where possible and using something that's an opening that employees can do with their elbow. Now, I don't know if that's something that you can do to, reconfigure your space, but again, just to keep thinking about how do I keep my employees safe and what can I do that's reasonable and that helps to prevent the spread of this disease. The 7th tip then is communication and training. So it's great if you put all these processes in place and you talk about that you're going to encourage them to stay home and that you're going to have a policy for what they do if they develop symptoms and how they're going to be screened and some of those different tips that we've talked about. But if you don't communicate that and if you don't train your employees on that properly, then it's really not that important if only the supervisors or managers know it. So really making sure that you set up a process where all the employees are going to go through all the training on hand washing. They're going to go through all the training on who to report to if they're sick, who to call if they can't come in, and that you do that with everybody all at once. And I would make sure you document that when that training takes place and get signatures for your employees that they attended that. If you have new hires, then of course you're going to make sure they go through that all again. And maybe some other frequent communication tips, or maybe there's things that you can hang up in different locations that people will see frequently as a reminder. Here's some signs that talk about hand washing. If we have employees that have email, we're going to send out some emails to them with tips and tricks. So communication and training to your employees is really important. And I know that's one of the preparedness plan points that Governor Walz has put into place and that he has recommended that people do. And then the last 8 number tip for you would be ask your employees and seek employee involvement. It's always good, no matter what the situation is, to try to poll your employees, gauge them on how they're thinking and feeling about things and get ideas from them. But especially now, as we think about how we can keep them safe, health and safety tips, a lot of times those employees that are on the front lines might have some really good ideas for things that can be done. So make sure you're asking them. And if they've given suggestions that you can't put them into place or you don't feel it's feasible, make sure you tell them why, explain to them. But whenever possible, try to see if you can accommodate the things that they're suggesting, as long as it's reasonable, and follow up with their involvement. So again, to go through our 8 most common tips: actively encourage sick employees to stay home, screen them as they're coming into work for the day, set up social distancing policies within the workplace wherever possible, if that means changing assembly lines, changing office setups and cubicles, or really the main thing would be if you can let them keep working remotely. That's the easiest thing. Number 4 is the hand washing tips. Number 5 is the respiratory etiquette, how we cover our cough and sneezes, coughing into our elbow, those things. 6 is housekeeping and just general cleaning. How are you cleaning the facility? 7 is communication and training. How are you training and communicating these guidelines and recommendations to the employees? And then number 8 was just to seek the employee involvement. And as we've already mentioned, there is a lot of resources out there. The CDC has a ton of stuff depending on your specific industry. OSHA has a ton of stuff related to specific industries. So just go ahead, and if this does not provide enough detail for you, look at some of those other resources. Reach out to us if you have other questions, and we'll try to see what we can find out for information as well and see what's being recommended. But overall, we just really want to encourage you in this time. The health and safety, physical safety of your employees is so important. And as we're looking at reopening up businesses that have closed and states that have closed, what is the plan that we're going to put in place? And again, I know that Minnesota Governor Walz has done a great job of trying to outline some of that, and he's provided a document that you can follow along with and put into place, but it's really important that you do it. And so we just really encourage you all. If you have any questions, please reach out to us. Again, my name is Natalie Raymond, Multi-Business Solutions. We'd be happy to help, or any other resources that you have. Your HR department may have some good resources, attorneys that you work with, things like that. And thank you all so much, and we wish you the best of luck, and we're rooting for you. So good luck. Thank you.